Vitamin D is super important for our health. It's often called the sunshine vitamin because our body makes it when we're in sunlight. But lots of people don't get enough sunlight, and that can lead to a vitamin D deficiency. This deficiency can cause some serious health problems like weak bones, a poor immune system, and more. While sunlight is the best source, we can also get vitamin D from our diet and supplements. This is where things get a little tricky. Vitamin D isn't just one thing, it comes in two main forms. D2, also known as Ergocalciferol, and D3, or cholecalciferol. Both D2 and D3 are meant to increase vitamin D levels in our bodies. However, they differ in their sources, how well they work, and how our bodies use them. Understanding these differences can help you make smart choices about your vitamin D intake. This video will dive into the details of vitamin D2 and D3. We'll explore their unique features, compare how well they work, and discuss which one is right for different dietary needs. By the end, you'll be well equipped to choose the best vitamin D for optimal health. Vitamin D2, or ergocalciferol, is made by plants as a way to protect themselves from sunlight. It's commonly found in certain foods and dietary supplements. For vegans and vegetarians, D2 is usually the preferred choice because it comes from plants. One of the main sources of D2 is mushrooms. When exposed to ultraviolet, UV light, mushrooms, just like humans, change a compound into vitamin D2. This is why some commercially available mushrooms are treated with UV light to increase their D2 content. Besides mushrooms, D2 is often added to fortify various food products. Plant-based milk alternatives like almond milk, soy milk, and oat milk are often fortified with D2 to make their nutrition similar to cow's milk. Similarly, some breakfast cereals are fortified with D2 to boost their nutritional value. While D2 is a workable option for increasing vitamin D levels, it's important to note that it might not be as effective as D3. We'll talk more about this in the next sections. Vitamin D3, or cholecalciferol, is often called the sunshine nutrient because our bodies naturally make it when our skin is exposed to sunlight. It's also found in certain animal-based foods and supplements. When sunlight hits our skin, it interacts with a type of cholesterol, 7-dehydrocholesterol, turning it into vitamin D3. This process is really efficient, and a short amount of time in the sun can produce a lot of vitamin D3. However, things like where you live, the time of day, the season, your skin color, and if you're wearing sunscreen can really affect how well your body makes vitamin D3 from sunlight alone. For those who don't get enough sunlight or have dietary restrictions, vitamin D3 supplements are a handy solution. These supplements are commonly made from lanolin, a fatty substance found in sheep's wool. However, there are also vegan D3 supplements available that are derived from lichen, a symbiotic organism of algae and fungi. Vitamin D3 is considered the most bioavailable form of vitamin D, meaning our bodies can absorb and use it more efficiently than D2. This makes D3 supplements a popular choice for addressing vitamin D deficiency. Section 4. How vitamin D works its magic. Both vitamin D2 and D3, although from different sources, follow a similar path once they get into our bodies. They are absorbed into the bloodstream and carried to the liver. In the liver, they go through a transformation process, becoming 25-hydroxyvitamin D, also known as 25-OHD. 25-OHD is the main form of vitamin D circulating in our blood. It serves as a marker for assessing vitamin D levels in the body. When healthcare professionals test for vitamin D deficiency, they measure the concentration of 25-OHD in the blood. From the liver, 25-OHD travels to the kidneys, where it undergoes another crucial transformation. It is converted into its active form, 1,25-dihydroxyvitamin D, also known as 1,25-O2D or calcitriol. Calcitriol is the biologically active form of vitamin D that our body can use. It acts like a hormone, binding to vitamin D receptors found in various tissues and organs throughout the body, including the gut, bones, kidneys, and immune cells. Through these receptors, calcitriol regulates calcium and phosphorus absorption, bone health, immune function, cell growth, and inflammation. This complex and intricate process highlights the vital role vitamin D plays in maintaining our overall health and well-being. Section 5. The D2 versus D3 showdown, which one reigns supreme? While both D2 and D3 aim to boost vitamin D levels, research suggests D3 may be the better option for most people. This is mainly because it's more potent, absorbs better, and has longer-lasting effects in the body. Studies have shown D3 is more effective at raising and maintaining blood levels of 25-OHD, the main circulating form of vitamin D. This means that taking an equal dose of D3 will likely result in a bigger increase in your vitamin D levels compared to D2. Additionally, D3 seems to stay in the body longer than D2. This means D3 stays in your system for a longer time, potentially providing extended benefits. This characteristic also makes D3 more efficient at fixing a vitamin D deficiency. Another advantage of D3 is its higher bioavailability. Our bodies can absorb and use D3 more efficiently than D2. This difference in absorption could contribute to the observed difference in their effectiveness at raising and maintaining vitamin D levels. However, it's crucial to remember that individual responses to D2 and D3 can vary. Factors such as genetics, age, health conditions, and dietary habits can influence how our bodies process and utilize these vitamins. Section 6. Choosing the right vitamin D for you. Choosing the right vitamin D supplement can be confusing with so many options available. The best way to figure out if you need a vitamin D supplement is to get a blood test. A simple blood test can measure your 25-OD levels. For vegans, D2 or vegan D3 from lichen are good choices. D3 from lanolin is not suitable for vegans. Talk to your doctor to figure out the right dose. Choose a form that fits your routine. Go for well-known brands and supplements tested by third parties. Make an informed decision with your doctor. Section 7. The risks of vitamin D deficiency. Vitamin D deficiency is a worldwide health problem affecting lots of people. It can cause health issues from mild to serious. In kids, it can cause rickets, which makes bones soft and causes growth problems. Rickets leads to skeletal deformities and bone pain. In adults, it can cause osteomalacia, which makes bones soft and causes muscle pain. Osteomalacia is often called adult rickets. Vitamin D is key for calcium absorption and bone health. Deficiency can increase the risk of osteoporosis and fractures. If you think you might have a deficiency, talk to your doctor. They might recommend changes to your diet, getting more sunlight, or taking supplements.